let's look at the specific side effects of methylphenidate. Common side effects are headache, insomnia, decreased appetite, dry mouth, dysphoria, mood disturbances, irritability, and this can happen in the early stages. In most individuals, in the first few weeks, many of these side effects will subside. So in the first week, one gets a feel for how they're responding. We need to ensure that we're treating the appropriate diagnosis and making sure that they don't experience these heightened side effects. In clinical practice, it's very common in the first few days, patients experience that anxiety a bit. However, in about 2 to 3 days, that anxiety goes away. In fact, many individuals, when they start experiencing benefits, will talk about feeling calmer, able to engage in tasks much better, the procrastination goes away, etc. What's important here is to look out for the development of tics. If this happens in the early phases, then one should be cautious about increasing the doses ongoing. One may need to counteract this effect with, say, alpha-2 agonists in the early stages itself. The second important aspect is to monitor blood pressure. Methylphenidate can cause small increases in blood pressure and heart rate, but this is more likely with the immediate release, and shifting to a long-acting agent generally will reduce this. However, if this persists, then it's a discussion to have with the patient and the general practitioner to decide as to whether we need to counteract this with an alpha-2 agonist such as clonidine, which has an inbuilt imidazoline receptor agonism that reduces blood pressure. Rarer side effects include mood changes, heightened and persistent anxiety, depression, and of course, psychosis. This is most common if there is a predisposition to psychosis or bipolar affective disorder. Hence, it's very important in the original diagnostic assessment to carefully rule out bipolarity, carefully rule out predisposition to psychosis. Close monitoring for worsening of mood symptoms along with emergent or treatment emergent self-harm behaviors is something to closely monitor as well. Allergic reactions can occur, but they're very rare. In some individuals, side effects such as Raynaud's phenomenon can occur. And this is the peripheral vasoconstriction. So they can come to you saying that their fingertips have turned blue. This is more likely in individuals that may have certain autoimmune conditions that enhance the risk of vasculitis. This particular side effect is more likely due to the alpha receptor activity, where the peripheral vascular resistance has increased, and Raynaud's is a manifestation of that. So one can consider vasodilatation in a way by using clonidine or even guanfacine, which are alpha-2 presynaptic agonists. So to summarize, methylphenidate increases noradrenaline and dopamine. Importantly, it does not increase serotonin. It's available in immediate release, Ritalin. It's available in 2 long-acting forms known as Ritalin LA and Concerta.